In this video, we're going to take a look at the nasogastric tube and associated assessments around it. So again, the purpose of the tube is to remove excess air and fluid from the stomach. So let's assume the tube is already in situ, and now we're just coming to do our assessment. And we start, of course, by asking the patient how they feel, because one of the chief symptoms associated with an NG tube insertion is nausea due to gas and fluid building up in the stomach, and typically on a general surgical unit it's associated with some kind of ileus, a bowel ileus. So we ask the patient how they're doing. They say they're nauseated or they say they're fine. Hopefully with the NG in situ they're saying they feel fine. And then we'll do our associated abdominal assessment, which is in another video, around examining, listening, and palpating. So let's say we've done all that and we're happy with that. Now, by the way, if the patient is complaining of nausea at this point, of course, we're going to take that in consideration as we assess our NG tube, and we're going to take that in consideration when we can consider our interventions, like maybe we need to check placement of the tube with x-ray. Maybe we need to offer an antiemetic. But we'll leave those for a different video. Right now, here's just how the basic assessment of the nasogastric tube system looks. Start with the nose. Is it taped to the nose properly? If it's not, we need to fix that. I recommend using skin prep whenever you apply one of these nose dressings, because it stays in a lot longer through patient diaphoresis. So when they sweat, these dressings come right off and the tube falls out. So please take the time to use the skin prep, and it'll stick a lot better. Next, you're checking to see what is the internal length. The internal length is what goes going from the entrance of the nostril down to the stomach where this tube is sitting, round about the xiphoid process area. And you're measuring that by way of simply looking at the number that you can best see near the entrance site of the nostril. Sometimes that's covered by tape, so you have to do your best to approximate what that number is. The person who inserted the tube should easily get the number because they've done the measurements. They'll get the number, and that should be what you're seeing. But again, sometimes it's blocked by the tape. And that is why best practice is to also do an external measurement. An external measurement involves taking a piece of plastic tape measure and going from where the tube enters the nose down to where the NG tube meets the suction. So you measure that, you measure this whole bit here with the tape measure, and you find out what is the external length. And you chart both, internal, external length. Next, you're looking at the tubing to see if anything's flowing, making sure there's no kinks, of course, and pinned to the gown. Ensure that it's pinned to the gown in such a way that the patient can turn their head both ways. Sometimes I've come into the room and I've seen these pinned in a way where the patient can't turn their head, so I'll just move it up and adjust it so they can turn freely without pulling on the NG system. Then you're looking at where it's attached to suction, looks good. Then you're looking at this filter here. This is an air filter, and notice how the holes are facing outwards. That's how it should look, because it needs to suck a small amount of air into the system to maintain movement in the tube. If you find this is put on the wrong way and there's no holes showing, what you're going to find is there's no net movement in the NG, in the whole system here, the whole suction system, because a vacuum is being created, because with no air, this is a closed vacuum. So if you come across a situation where there's nothing flowing in the tube, it could be because this filter is being put on wrong. And you keep assessing, you're looking at your suction tubing now and seeing if there's any flow through here. Then of course you get to the suction machine itself and you're seeing that it's set. Well, if usually what's ordered is a low suction rate. It could be continuous, low continuous suction, or it could be low intermittent suction. Often low continuous. And low suction means 40 to 80 millimeters of mercury. Now it's okay if it's at 40. It's okay if it's at 80. Anything between those two numbers is going to achieve the necessary suction to empty out the stomach. Then you're checking to make sure everything's attached. And then lastly, you're looking at your container to make sure it's not getting too full, and you're noting the color and characteristics of the fluid. And that concludes our NG or nasogastric tube assessment.